Hi, I'm Dove Sinclair with the Power of the Patient Project. My guest today is Dr. James Wang. Dr. Wang is an obstetrician-gynecologist in Springfield, Massachusetts. He is also an assistant professor at UMASS Baystate Medical School, where he teaches OB/GYN residences, medical students, and advanced practitioners, in addition to seeing his own patients in a faculty practice. A graduate of Tufts University School of Medicine, Dr. Wang was in a private practice before joining academic medicine, and he has been caring for patients for over 30 years. Dr. Wang is also a staunch patient and physician advocate. He serves on several committees addressing patient safety and rights, and has been an active member of the Massachusetts Medical Society, where he's a long-term delegate, member of the Legislative Committee, Nominations Committee, and appointed member of the Task Force on Physician Burnout. So welcome, Dr. Wang. Thank you so much for joining me.
Thank you, Dove. Thanks for having me.
Sure. So first, can you explain the scope of an OB/GYN and kind of what the specialty of the practice is?
Yeah, when folks hear OB/GYN, they often think, oh, babies and pap smears. It's so much more than that, though. Years ago, it pretty much was babies and pap smears, but since then, with the advancements of medicine and knowledge, our specialty has expanded dramatically. Our care actually covers the entire lifespan of women and females from birth up through menopause and even through death, unfortunately.
Mm-hmm. Wow.
So, part of the obstetrical portion is OB care, and that's a large portion of an obstetrical gynecologic practice. So OB care involves prenatal care, monitoring for medical conditions that may be related to pregnancy or non-related to pregnancy. People will often have pre-existing medical conditions that we need to watch when they're pregnant. For instance, someone may have chronic hypertension, high blood pressure, diabetes. So these are things that we need to know about early on when a woman's pregnant, so we can manage them and help monitor conditions related to that. During routine prenatal care, we also do routine testing to check for certain types of infections, make sure people have immunity to the appropriate viruses. We do screenings for diabetes. We do ultrasounds to check on fetal growth and anatomy. So there's a whole myriad of tests that we do prenatally. Mm-hmm. We also deliver babies, and that can be something as simple as watching someone's labor progress normally and having a vaginal delivery. Sometimes there are complications or situations where we would need to deliver by cesarean section, so we're able to do that as well. And we also provide postpartum care. So once a woman has delivered, she'll follow up with the office, make sure things are going well, make sure she's getting enough sleep as best as she can with a newborn. Right. And make sure that everything is going back to normal and that she is emotionally doing well. Pregnancy is a very stressful situation, both for the physical portion of a woman, but also for the emotional aspect. So we also screen for postpartum depression at the postpartum visit.
Mm-hmm. Wow. And now what about, so that's just the OB side, or is that also the gynecology side?
That's mostly the OB side. Gynecology, again, spans the lifespan. We take care of well visits. We do preventative care. Many women consider their OB/GYN as their primary care, mm-hmm. and particularly in women in the younger age group of, say, below 55 or so, many times they're the only doctors that they will see as their OB/GYN. Mm-hmm. As part of that, most of us will do a comprehensive physical exam, comprehensive history. We'll order many screening tests that are specific for women's health, which would be pap smears, mammograms, things like that. But we also do blood testing at times. We'll do blood tests for hormonal problems or blood counts, cholesterol screening at times as well, if we're the only practitioner that the woman sees.
Mm-hmm. Now, why is it important for a woman to see an OB/GYN in addition to their primary care? Or is it okay if a woman just has an OB/GYN and not a primary care?
That's a great question. Medicine is increasing in its knowledge in an exponential fashion. So every day there are hundreds of articles coming out updating medicine. OB/GYN is a specialty that deals specifically with women's health. So although some women are encouraged by their primary cares to get their routine GYN care visits with them, I feel that there's so much medical knowledge that is out there that women are best served by seeing a GYN for their regular GYN annual visit. We have to remember that the primary care practitioner is taking care of men and women. Sometimes they're taking care of children as well if they're family practitioners. And they're dealing with every organ system in the body. They're dealing with people's mental health. They're dealing with things like stroke and heart disease, diabetes, osteoarthritis, all kinds of different problems.
Right.
So it's hard for them to keep up with the medical literature, particularly when women's health is such an advancing field right now. The OB/GYN is the best person to see in terms of women's health care.
Yeah, definitely. And I saw that you have a 5-star patient experience rating, so congratulations on that.
Thank you.
How do you make patients feel comfortable and uphold that patient-provider relationship?
I have a basic philosophy that says every patient should be treated as if they're my family member. I would want to make sure my family member gets the best care that they can. So I have that as my philosophy, saying make sure that I do that. I also have a rule of everys. Every patient is my partner in her healthcare. Every patient has her own story. Every patient has her own journey, and every patient makes her own choices. Using that philosophy, I really make sure that patients are part of the decision process. I look at the entire person before I make clinical decisions. I look at her beliefs, I look at her social situation, I consider her fears and her expectations before I actually come up with treatment plans that we can discuss and review and make decisions on their own. I also believe that education is very important. Many times patients will go see their clinician and the clinician will say, you have this condition, therefore I'm going to give you this prescription and I'll see you in a year or 6 months. I will make sure I take time to explain to the patient exactly what condition she has, exactly what the options are, and the pros and cons of each of those options. So when she makes the decision about what choice she wants to do, or what choice care she wants to follow, she knows why she's making that choice, and she understands that. Finally, I listen a lot and I observe. I don't interrupt patients as much as I can. If you look at some of the national statistics, they basically say that the average patient has about 30 seconds of speaking before the clinician interrupts them. So I try to be as quiet as possible, listen as much as I can. I also observe. I observe their demeanor, observe how they're feeling. If someone's very tense, you can see that. And so I'll spend more time or have little techniques that will help them relax a little bit more and then be able to give me more information more comfortably.
Yeah, that's a great philosophy to follow. I think that, you definitely need to look at the patient as a whole person and not just, clinically.
Yeah, that's one of the things that I really stress with teaching the residents and the medical students is that you're a specialist, but whatever physician you are, whether you're a cardiologist or whether you're an orthopedic surgeon, you need to look at the body that's attached to the organ that you're treating. And I think that's particularly important in women's health because there's so many other facets involved in health in general.
Yeah, definitely. And now I know that there is kind of a medical trend going on where more women are becoming OB/GYNs than men. And I know like 30 years ago, maybe that wasn't the case. So why do you think this is? And are there any disadvantages or advantages to this trend?
In 2019, it was the first year that there were more women medical students than male medical students. Currently in OB/GYN, about 60% of OB/GYN, practicing OB/GYNs are female, and in the residency class, the learning classes of OB/GYN, about 84% of them are female. This is a great trend. We're seeing this trend not only in medicine, but other professions as well. So it really helps to see that the workforce is expanding. One of the traditional things that's been found in medicine, because most likely that it was a male-oriented profession, is that much research and many recommendations were based on men. Very few studies were based on women. So with women being in a larger percentage of the workforce now, I anticipate, and I am seeing that we're seeing more research based on women's health, specifically for women. And that's going to make a great difference in general care. The important thing to remember, though, is that it's not necessarily gender that makes a good physician. So while many women may prefer a female practitioner for their GYN, it doesn't mean that you can't see a male physician and have as good or better care than any other person. So that's one thing I like to stress with patients who may be reluctant to see me. It's like, well, you're a guy. I said, yeah, but I'm a doctor first. Most of the time, because of my philosophy and following through with that, patients see that very quickly, that I care about them as a person and as a partner in their healthcare, that it doesn't matter that I'm a male.
Yeah, no, that's great. Yeah, and I agree, like, more women, and some women feel more comfortable with, a female doctor rather than a male, but yeah, it's definitely something to keep in mind, that especially with your philosophy, I assume that most patients would feel comfortable, which is great. So I understand that you're also on the task force on physician burnout. Can you talk a little bit about that?
Sure. The Massachusetts Medical Society recognized that physician burnout was a very significant concern in the medical field. Physician burnout essentially refers to the fact that due to pressures of practice, and those come in many forms, physicians are under stress in terms of trying to make sure they're continuing to give good care. The task force was created by the president of the Massachusetts Medical Society about 2 years ago, and I was appointed as an OB/GYN to input my perspective into what's going on. The task force looked at several different factors in regard to why physicians are experiencing stress in practice. And that's probably a better term than using burnout, because burnout sometimes will infer that it's the person who is being affected, their inability to tolerate the conditions. And in fact, the conditions are the ones that are sometimes overwhelming, that it's difficult for physicians to continue practice. One of the leading causes of burnout was the fact that we're dealing with electronic medical records now. Although medical records in the electronic form are purported to be much faster and easier to deal with, in reality, they're not. There are good parts to the medical record where that we can access information relatively quickly and review labs relatively quickly and remotely, but the difficulty is getting that information into the right place in the right way so that someone else can retrieve it. So a good portion of physicians' practice now, up to a third of the time the physician spends with a patient, is in documentation, whereas before, when we used different types of records, it was maybe 10% or so. Another factor in physician burnout is administrative problems. Insurance companies require a lot of pre-authorization for testing and medications, and that puts a lot of time and pressure on physicians to get that information into the insurance companies. Sometimes the pre-authorization is not accepted, so quite often we'll be doing it 3 or 4 times for one test or one medication. So that's a factor. Some of the other factors include a lack of ability of self-control. Many physicians are employed now by large groups, and they are dictated by the large groups to see a certain volume of patients and see them in a certain way and refer them to certain practices. So that can be a factor as well in terms of the physician's inability to be in control of their own schedule. Many physicians need to spend a lot of time with their patients. And if you're working for a large corporation that says you need to see 6 patients an hour regardless, that doesn't lead to good medicine. And for physicians, not practicing good medicine is a major stressor as well.
Yeah. Going back to your first reason, I know that you mentioned charting and things like that is, a huge portion of what physicians are doing right now that's leading to burnout. I recently did another interview with a medical scribe. So is that like a person that more physicians need, a medical scribe to be in there? Would that help them, write things down, dictate notes and everything? Would that help, do you think?
I personally feel it's an excellent idea. I have a medical scribe. I've had medical scribe for about 2 years now. Initially, when I was offered a scribe, I said, no, I can do this on my own. But it was a pilot program and they needed to have another physician use the scribe. I said, I'll test it out. And I said, I'll see how it is in a few months. I came to quickly realize that it's much better for patient care, at least in my practice, because I'm spending more time talking to the patient, listening to the patient, watching the patient, while the medical scribe is taking the information down on the chart. It's also very helpful because we'll have a conversation with the patient and she'll say, oh, I had the blood test done, or I had some tests done 3 weeks ago. I'll be able to say, can you look that up, please? And my scribe will look it up and go over the result, and we can talk right then and there about the result, rather than my saying, okay, let me try to remember that. So when we go back later, we can discuss it. So it's real-time information. It also saves me a tremendous amount of time because the scribe is writing the notes while I'm talking to the patient. One of the things that I do personally is I will usually see the patient in my office after the exam in the examination room. I think during the time the patient is getting dressed and getting put back together, she's thinking about what questions that she might have forgot to ask me, or what issues that we discussed. So when she comes back to my office and sits down next to me, she has the ability, and she's more comfortable to say, oh, you know what, I forgot to ask you this or that. So that gives me more time with the patient as well to discuss that while the scribe is writing up the note.
Yeah, I definitely think that medical scribes are a huge lifesaver for doctors like you, and providing better patient care overall. And now I know you're talking about insurance and things like that, because insurance companies, they require a lot of information from the patient, et cetera. So isn't that something that the support staff handles, like the people at the front desk? Or
they often do, but the initial pre-authorization needs to have the medical reason for it. So the physician will generate it, and then it comes back as a refusal, and the physician has to go back and say, okay, why was it refused? And then so the staff comes back to the practitioner and says it got refused because they don't cover that on formulary. For example, I had a case a couple of weeks ago where I prescribed a medication for osteoporosis for a patient, and the insurance company said it's not covered. And so I said, well, what is covered? Well, you have to write the next prescription before we can tell you what's covered. So I went through 3 different prescriptions before one was actually covered.
wow.
They were not able to say, we don't cover this drug, use that one instead. They say, choose something else and we'll tell you if it's covered.
Yeah, I can see why that would be a leading cause of physician burnout. Do you think that having a larger staff, like in your faculty, helps physicians, or does it make things a little bit more confusing with more people?
A larger staff helps to some degree. Unfortunately, if you look at the economic side of medicine, a larger staff means more overhead costs.
Right.
So that means you have to see more patients. So one of the things that you have to balance well is making sure your patient volume is not excessive to support your medical staff, because if you do that, then you're not providing good care. So it's one of those, it's a conundrum, because the more staff you have, the easier it is to practice, but the more staff you have, the more cost it is, and therefore the more patients you have to see.
Right. Yeah, definitely. Do you have any other tips for, physician burnout, or anything anything you would like to add?
Well, for physicians, you really need to get together as a group and look at solutions. Many hospitals and organizations now have particular medical officers in charge of physician wellness and physician health. And that's important because you need to have someone who's been on the inside or continues to be on the inside practicing medicine to be able to look at the issues and to come up with solutions. The hospital administration and the employing administrations, companies need to understand that the solutions that are being recommended are going to help patients in the long run.
Yeah.
For patients, I think sometimes physicians will take out their frustrations on the patient. I've had patients say, oh, so-and-so was just really difficult to deal with. He was mean or she was mean. Having known some of the physicians that patients had remarks about, I'm pretty sure that it was a stressful situation where they were just overwhelmed, and it's unfortunate. So to some degree, patients, I think it would be helpful if they could look on the other side and say, yeah, I'm the 14th patient this doctor has seen today, and I know it's difficult for them. It's not an excuse for us to be short or terse with a patient, but we are all human and we all have good days and bad days. So I think the understanding going back and forth is important as well.
Yeah, definitely. Well, thank you, Dr. Wang, for joining me and explaining all this great information.
Thank you very much.